I'm speaking specifically today about S2383, the bill that would call on the federal government to pass Medicare for all. The Rhode Island State Senate would be calling on the federal government. We already know that a single payer would save money and save lives. We've had that discussion today, and the Lancet study and comparisons of health outcomes and health spending around the world bear it out. My testimony that I submitted to the committee focuses not so much on the policy, but on the political history of Medicare for all and similar systems around the world. This history tells us that this kind of legislation is indeed difficult to pass, no doubt about it. In the UK, the NHS was passed in the 1940s, even though some prominent members of the British Medical Association compared it to Nazism. But today, the NHS is one of the most cherished and valued parts of British life. In the 1960s, Canada passed its version of single payer called Medicare, and that sparked a doctor's strike, and yet today it is a treasured and valued part of Canadian life. In the United States, Medicare, passed by LBJ and the Democratic Congress in the 1960s, faced opposition from future President Ronald Reagan, and the doctor's lobby and the insurance lobby, and today it is a treasured part of American life. So we know that these kinds of bills are difficult to pass. We understand their historic difficulty, but we also understand their historic importance. Even so, for decades, single payer has been seen as kind of a utopian pipe dream. You know, it's something that we want, but the path there seems quite difficult. President Barack Obama, when he was president, said as much when he said that if he was starting a system from scratch, he would have picked single payer, but given the system we had, given the political realities of the time, he thought the ACA was as much as he was going to get. And that, I think, was true in 2008, but times have changed in 2020. Things have certainly changed on the ground in the emergency department where I work every day. High deductible health insurance plans have proliferated. Administrative costs have gone way up. The cost of prescription drugs continues to go up, and the cost of ED visits goes up. Some hospitals have taken to suing their own patients and putting liens on their houses and garnishing their wages if they can't pay their bills. And I did not go into this to bankrupt my patients. So I just want to finish my time with a couple patients who were particularly affected by the system we have now, by our insistence on the status quo, because they're the patients I lay awake at night thinking about when I realize that I'm part of this system. I think about the young woman who came in with a potentially fatal complication of diabetes called ketoacidosis, which we know how to treat but can still kill her because she couldn't afford her insulin. She's not the only one who came in with that complication for that reason. I think of the elderly woman who hesitated at my recommendation to stay overnight when we wanted to test her for potential heart attack that we couldn't detect immediately on her arrival, and she kept asking me, how much is this going to cost? I knew it would cost in the thousands of dollars, but all I could tell her in addition to that was my medical recommendation, but I knew this would be a tremendous burden on her and her family. I think of the young man who came in after an opiate overdose who was, I was trying to have a conversation with him about medication-assisted therapy. I know Senator Miller has done an amazing amount of work on this issue, but all he could talk about was how much this hospital bill was going to be. And I couldn't even have a discussion with him about what he needed going forward. The worst one, though, is a couple months ago when a woman came in with a complaint of a breast mass. That was the chief complaint on her when I picked up her chart. And I was a little confused as to why, with that complaint, she wasn't at her primary care doctor or gynecologist. But when I met her, I realized what was happening. Under her gown was a large fungating mass of dying and necrotic tissue, and it looked incredibly painful, and it was. She told me that she'd noticed the mass months ago, but she was afraid to go into the hospital or to see her doctor because she was afraid what it all would cost. She had worked in insurance. She had worked in health insurance, and she knew what it would cost. And she was afraid of the burden it would put on her family. By the time she came to us, all we could offer her was pain control and hospice. So, we live with the system today, but we don't have to. Congressman Cicilline supports Medicare for all. Congressman Langevin supports Medicare for all. Senator Whitehouse supports Medicare for all. And now the Rhode Island State Senate has the chance to step forward on the right side of history and support Medicare for all. So I hope you take the chance. Thanks.